Hello, everyone. My name is Monica Watson, and I'm here today to propose a new policy to the legislators and to convince you that changes need to be made about a serious issue that concerns the public. The issue I'm addressing today is smoking. Tobacco use is a huge epidemic within our community, which does not only affect the people using it, but also everyone else. There are many health risks associated with cigarette smoking, which are heart disease, heart attack, strokes, as well as high blood pressure, asthma, and COPD. Smoking is also known for cataracts, gum diseases, infections, and infertility. According to the New Zealand Medical Journal, which was released in 2012, smoking is the biggest cause of preventable death and ill health in the developed world. All health interventions, those that can reduce the prevalence of smoking, will have the biggest impact on health. The main major health concern for smokers is cancer. Smoking can cause cancer almost anywhere in our body, but is mainly associated with lung, mouth and throat, as well as liver cancer. Lung cancer, for example, claims more lives each year than colon, prostate, ovarian, and breast cancer combined. Lung cancer, as well as mouth and throat cancer, are caused by substances also known as carcinogens, which are present in cigarettes. A carcinogen is a cancer-causing chemical found in some products. Tobacco smoke has at least 70 different chemicals that causes cancer. By inhaling cigarette smoke, the cells that line the lungs, as well as the mouth and throat, are damaged and cause the cells to act abnormally and causes cancer to develop. Anti-smoking campaigns from the CDC and the warning from the Surgeon General informs people about the health risks related to smoking. The use of cigarettes is declining, but according to the CDC, in 2016, nearly 38 million American adults still smoked cigarettes on a daily basis. There are certain groups at a higher risk to become a smoker than others, which are people with lower education, low poverty level, and disabled people. Smoking doesn't only affect the smoker himself, but also people in his surroundings. Children are often affected by secondhand smoke since their parents smoke in enclosed spaces, such as vehicles or in their home. Children are unable to protect themselves from this danger and are in the mercy of their caretakers. Many children develop asthma or later on cancer because of secondhand smoke. Due to the addicting characteristics of cigarettes, females often do not quit smoking when they become pregnant, which results in low birth weight and other medical conditions of the infant. Since the majority of smokers have a low socioeconomic status, many of them are uninsured, underinsured, or rely on government programs such as Medicare and Medicaid. The average cost per patient per year to treat cancer ranges from $100,000 to $400,000. So the question here is, who pays for these treatments? Either government programs or the healthcare facility itself covers these costs by providing charity care to low-income individuals. Even if people have insurance, the costs put a large burden on insurance companies. For the insurance company to make up for these charges, they have to increase their prices, which results in higher premiums for everyone. Excessive government spending on healthcare has a great impact on economy. I am proposing today to increase cigarette taxes to a national level, which means that tax prices in every state are the same. New York State excise tax rate is $4.35 per package of 20 cigarettes, and the highest in the country. A pack of cigarettes costs an average of $11.50. The national medium tax is $1.34. I am proposing to increase the cigarette tax rate to $4.35 nationwide. Since New York increased their cigarette taxes, adult smoking prevalence has declined from 35% to 14% between 2002 until 2010. The national average is 18%, which is higher than New York. The current issue that New York is facing is that cigarettes are smuggled in across state borders since they are cheaper in other states. New York lost $1.6 billion because of untaxed sales due to the smuggle. If all states have the same taxes and the same price for cigarettes, it will prevent the smuggle of cigarettes. According to a study published by the Mackinac Center, smuggling activity promotes violence against residents as well as police officers. Oftentimes, the money earned from smuggling is used to finance terrorist organizations, counterfeiting tax stamps, and other legal activities. I am proposing this new policy to deter people from buying cigarettes. In addition, the taxes can be used to provide more services to help people to quit smoking. The additional revenue would help the states to cover the medical expenses they have from government-funded programs. The implementation of the policy should not cost the states any additional money, but rather provide extra revenue and reduce healthcare spending in the long run. Why should you vote in favor of my policy change? It is very simple, because it is in the best interest of the United States and its citizens. With the increase of the cigarette taxes nationwide, we will deter more people from buying cigarettes, have enough funding to provide programs that help people to quit smoking, reduce governmental as well as private insurance healthcare spending on tobacco-related issues, and avoid cigarette smuggling across state lines. Thank you.